The next clinical feature is atrophy of papillae of tongue. Atrophy means loss of papillae of tongue. Next is the diagnosis. Diagnosis: dietetic inquiry, history of the diet pattern, then physical examination, anthropometric measurement like height, weight, mid-arm circumference, head circumference, then peripheral blood smear. Peripheral blood smear, you can see whether child is having anemia or not. Then stool examination, any occult blood examination, infection, then urine examination are the diagnostic evaluation of kwashiorkor. Then what are the essential criteria for diagnosis? Growth retardation, low weight and height. These children, growth retardation, low weight and height. Muscle wasting, muscle losing with retention of some subcutaneous fat. Muscle wasting and retention of some subcutaneous fat. Then psychomotor changes as evidenced by mental apathy in the form of inertness, lack of interest in surroundings, hypoalbuminemia, and pitting edema. Psychomotor changes evidenced by the mental apathy in the form of inertness, lack of interest in surroundings. Next one is hypoalbuminemia and pitting edema. Then non-essential characteristics: hair changes, that is light colored hair. I told is hypodysphigmentation. Then areas of alopecia. Alopecia means loss of hair. Changes in texture and easy pluckability. Hair can easily pluck. Then alternate bands of light and dark color. Alternate bands of light and dark color, which is called flag sign. Flag sign is the alternate bands of light and dark color in the body. Periods of inadequate and adequate nutrition over a period of time. Due to the periods of inadequate and adequate nutrition over a period of time. Then skin changes include light colored skin, dermatitis, area hyperpigmentation, intervened by area of low red skin caused by shedding of superficial skin flakes. Dermatitis, the area hyperpigmentation, intervened by area of raw red skin. In some areas, raw red skin caused by shedding of superficial skin flakes. Shedding means losing. Shedding means losing or falling the superficial skin flakes. Then gastrointestinal system, GIT system, diarrhea, vomiting and anorexia. Mineral and vitamin deficiencies are common in these children. Hepatomegaly, superadded infection. Superadded infection means one infection is already occurred. After that, the secondary infections, large strains of viruses. Then clubbing. Then what are the biochemical changes? Serum protein level is low, anemia moderate to severe, low serum enzyme. What are the serum enzymes? SGPT, SGOT, LDH. Next is the management of kwashiorkor. Parental fluid therapy. Initially oral feeding is small amount. Give parental fluid initially. Then oral feeding is small amount. Record intake and output chart. Record the weight daily. Provide period of activity and rest. Provide period of activity and rest. Dietary intake of calories, proteins are increased. Dietary intake containing calories and proteins are increased. Skim milk, synthetic amino acid mixture or casein hydrolysates to supplement the diet to increase the protein level and calorie level. Then vegetable fat, vitamins and minerals. Child initially lose weight because of loss of edema fluid. Vitamins and minerals. Child initially lose weight because of the loss of edema fluid. Then infections and infestations are treatment of complications. Then shielded represents the complications. It is shielded. Shielded means S, sugar level is low. Sugar level is low. Hypothermia. H stand for hypothermia. I stand for infections. E stand for electrolyte disturbances. DE diarrhea. D deficiency of nutrients. That is shielded represent the complication. Next is the prevention. What are the preventions of kwashiorkor? Put child on exclusive breastfeeding up to 6 months of age. Give 6 months breastfeeding only. Start weaning after 6 months of age to reach full adult diet by 2 to 3 years. From 6 months to 2 to 3 years, full adult diet which contain the protein. Parent education about the importance of adequate nutritional intake which contain all the nutrients, protein and carbohydrate. Prompt treatment of congenital defects. Prevention of emotional disturbances. Use of all animal and vegetable proteins. Give all animal and vegetable proteins. Continue breastfeeding up to 2 years of age. Then immunization. Oral rehydration therapy for diarrhea. These are the prevention of kwashiorkor. Put child on exclusive breastfeeding up to 6 months of age. Start weaning after 6 months of age to reach full adult diet by 2 to 3 years. Parent education about the importance of adequate nutritional intake. Prompt treatment of congenital defects. Congenital defects are treated early childhood period. Prevention of emotional disturbances. Then use all animal and vegetable proteins. Give all foods which contain proteins, both animal and vegetable. Continue breastfeeding up to 2 years of age. Then give immunization up to the age. Then oral rehydration solution for diarrhea. These are the preventive measures for kwashiorkor. Till now we see the nutritional disorders. First we see the malnutrition. What are the forms of malnutrition? Then protein energy malnutrition. Factors influencing what are the causes, prevalence. Then there are two types in protein energy malnutrition. First one is marasmus and two diseases, marasmus and kwashiorkor. Marasmus definition, etiology, causes, then pathophysiology, then diagnosis, then kwashiorkor definition, grading, etiology, clinical manifestations,